Welcome back. Today we'll be discussing 6 reasons why you might be experiencing some lower back pain when you're performing your squats. So the squat is a full body movement that's really effective at improving movement patterns, mobility, and strength, but there are some small things that if we do it incorrectly and we start either adding heavy weights or doing lots of repetition, can put more impact on your low back and cause lower back pain, which is the opposite effect of what we want to do. So that is what we're going to cover today. So let's go ahead and get started. The very first thing we have to look into if you're having some lower back pain with your squats is your stance. What is your foot position? And what we have to understand is that everybody's squat stance is going to be a little bit different. It's all based on your hip anatomy, which is going to be a little bit different for everybody. But what happens if you're using the wrong squat stance for your body type is it can cause movement compensation. So just for an example, if I do the traditional, which I see a lot of clients do, the hip width, toes pointed apart, and sink down, I can't sink very low. But then what'll happen to sink lower, I'll start hinging at my low back right here. And again, that's going to put more stress on my lower back. But if I fix my squat stance, which for me, it's going to be a little bit narrower with a pretty big toe out, what you'll see is I'm able to sink lower and keep my spine in a nice straight position. And that's going to limit the impact that goes through my spine and lessen my lower back pain when I'm squatting. The next thing we have to look at if you're having some lower back pain with your squats is ankle mobility. So if you have stiff ankles, this can impact your lower back in a number of ways. I mean, with walking and running, it decreases your ability to absorb those ground reactive forces and you get higher impacts. But more importantly for squatting is it causes movement compensation. So when you lack that mobility, your body's going to get it somewhere else. It's going to compensate to get into that position. And similar to the stance, what happens with stiff ankles, when you come down, if your ankles can't bend forward that way to get you down into the position, is your chest is going to fall forward, which again, if you start doing more reps or you start adding heavier weight in this position, it's going to put more impact on your back. So a short-term fix to that, and this is what you see at a lot of gyms, is putting your heels on a little elevation. That's going to help give you a little bit of extra motion as you squat down. But a longer-term solution is you have to start working on your ankle mobility and improving the range of motion of that ankle joint. The next thing we have to look into is mobility in our hips. So what can happen is if we don't have full mobility at our hips, especially at the bottom of the squat, what you're going to find is you get this compensation called a butt wink, where your pelvis really starts to tuck under you. And so I'll kind of show you what that means as I sink into the squat. I'm good in terms of my hip mobility till my thighs hit about parallel, which is you want to be, where you want to be. But if I start to sink any lower, look what happens to my pelvis. It really starts to tuck under me. And this is an unstable position for the spine, where again, if you start to do more reps or add more weight, can put a lot of pressure on that low back and cause pain. And so what we want to do, again, in the short term, the easiest thing to do would just be limit your depth. So just find where you can get to before your tailbone starts to really tuck under you. So for me, it's right about there. But in the long term, again, just like stiff ankles, you want to start working on improving your hip mobility so that you're able to sink a little bit lower into that squat position and keep that nice stable position for less lower back pain. So while some people have mobility issues that cause lower back pain with their squats and their hips and in their ankles, some people are on the opposite end of the spectrum where they're almost too flexible, and that ends up putting more impact on their lower spine. So one example is being too flexible or hypermobile in the mid-back. And so what this can do as you're squatting down, if you don't have control of your spinal movement, is you can almost overextend. It's hard for me to show because I'm not hypermobile by any means, but you overextend at that mid and lower back. And so as you sink down into that squat, I can already feel a little bit of pressure here on the lower back. So to fix this, what you really want to do is to control that spinal movement. And to do that, all you have to do is make sure you hold a slight abdominal brace as you perform your squat movement. That's going to lock your spine in place, hold everything together to prevent that hyperextension as you sink down, which again puts a lot of pressure on your lower back. Another cause of lower back pain when we're squatting has to do with our movement patterns or how we initiate that squat. And so what can happen a lot of times when people initiate their squat, as they're sending their hips back, they actually rock their pelvis forward. So it's kind of a subtle movement, but yeah, you rock your pelvis forward like that as you sink down. And what happens when you rock that pelvis forward is, again, you get that overextension in the low back, and just like the previous one, like I can feel that as I squat down. So the fix is the same as that hypermobile mid-back, where that's why it's really important to keep that brace as you're performing the squat. That's going to lock your spine in place, and it's going to lock your pelvis in place so that when you squat down, your pelvis and your spine stay in that nice neutral position to get rid of lower back pain when you're squatting. The last thing that we look for that can cause some lower back pain when you're squatting is called a lateral shift. And that's where you're performing the squat and you kind of shift off to one side. So if it's easier to see from behind, but if you squat down and you kind of, this is exaggerated, but you can see I'm kind of shifting to the right. And again, that's going to change what areas of your lower back take most of the load, and usually it's kind of like one-sided back pain is what you'll notice. So to fix that, this one's again a little bit more complicated to fix because it can be caused by a lot of things, and that's why the ankle and hip mobility that we talked about earlier is going to be really important, and single leg strength exercises. So another thing that can cause that shift is if you're stronger in one leg than the other. So things like lunges, any sort of single leg strength is really important to add into your routine. Another quick fix that you can try is with a little mini circular band like this. You're just going to put it right above your knees, and you're just going to do a banded air squat. And what this is going to do is going to activate those glutes. So if one glute isn't firing quite as well as the other, and that's why you're shifting off, you can feel it and fix it. And so to perform, all you're going to do is a tempo squat down. So really make sure you're pressing your knees out, again, to engage these glute muscles, and then really just kind of inch by inch move down. Just pay attention to what your body's feeling. Is one side working harder than the other side? And just wait until you can feel them both kind of activate, and you can just go all the way down and back up. When it comes to solving chronic joint pain, we want the squat to be part of the solution, not part of the problem. Remember, it's a really great exercise to improve movement patterns, improve mobility, and build strength. So that's why it's so important that we do take the time, especially if you're having low back pain when you're squatting, to assess and address these different areas from your ankles all the way up into your middle back to find the best solution for you. So I hope that video helped. If you have any questions, leave a comment below and I'd be happy to help. Thanks again for watching. My name is Dr. Carl Baird at Solving Pain with Strength. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.